Hello, welcome to Kickstart Your Health with Dr. Gil Winkelman. And I'm really excited to be here today and share some of the information that I've learned in my medical practice and things that I've done with people with anxiety, depression, insomnia, migraine headaches, various kinds of neurological issues, and behavioral and attention issues. And some of the stuff can be done on your own to help you or your loved one get better and feel better. And so that's some of the stuff that I want to cover and talk to you about what's different about the way that we present and treat some of these conditions. Before we get into that, though, I'd like to tell you a little bit about myself. So I'm a naturopathic physician, and I have a BA in genetics from UC Berkeley. My wife and I have a clinic in Portland, Oregon called Insights to Health. When I was at Berkeley and a little after, I was involved in Human Genome Project. Left that, got my master's in counseling psychology. I worked with a fair number of people with traumatic brain injury. Now, at that time, this is almost 30 years ago. At that time, we didn't know as much as we do now, but we were beginning to suspect that very small injuries could lead to big problems later. And then after I did that, I went to medical school. I became a naturopathic physician. For those of you who don't know what a naturopath is, in Oregon, we're trained as primary care doctors. And the biggest difference is that we focus on the whole person and not just particular symptoms. And we'll see why that's important in a minute. So when I was in medical school, and even now, I still work with veterans who've come back with head injuries. Now, they don't come in and say, "Hey, doc, I had a head injury," most of the time. Usually they're coming in because they have anxiety, depression, sleep issues, headaches, post-traumatic stress disorder. The interesting thing about it is most of their symptoms appeared way after the head injury occurred. And so all of these that you see on the screen are hallmarks of potentially being related to a head injury. And that's what we've really learned from a lot of the veterans coming back, particularly from Iraq, but also Afghanistan, is there's an injury that happens, they're fine for a while, and then some months go by, and then we start to see the problems show up. And that's not just veterans, that's anybody. For all of these people, not just veterans, traditional treatment didn't help. And the main thing is that if you don't treat the whole person, you're not really going to get anywhere, because oftentimes the problem isn't where you think it is. So that's one of the main things, that if you take nothing home other than one thing from this whole webinar, is that you have to treat holistically. And the results that we've seen at our clinic really literally have been changing lives, and it's been quite gratifying for me to see it, but it's been amazing for some of these families. So the first thing to remember is we can't treat individual symptoms. You might get symptom relief if you happen to treat that well, but it doesn't mean that the problem isn't going to come back or go somewhere else. So what are some of the common beliefs that people have about the brain? Well, first of all, one of the first common belief, and I would say, when I say these, I don't want to say that they're necessarily wrong. I would say that they're incomplete for sure, and some of them may be wrong. But the first one is that neurotransmitters are the key. So it's kind of interesting, and this goes on to the second one. Second one is drugs are easy. Generally, they don't necessarily solve the problem. You might get symptom relief, Um, and these two go hand in hand because it's been interesting that a lot of the problems that we see with mental health have to do with histamine. And I'll get into this probably in a future module, not in this one, but briefly touching upon this. Histamine is a neurotransmitter, and many of the drugs that you would take, like Paxil or Prozac, work more so because it has an antihistaminic property than any other of the serotonin or dopamine or some of the other things that they talk about. So that's something to kind of keep in mind about both of these, being misconceptions about how drugs work and what they're actually doing. The last thing I'd like to say is that, I'm a firm believer in counseling. I have a counseling background and so forth. But by itself, if there's something wrong in the body physiologically, it's not going to help. And, that's a lot of what we talk about is, some of the stuff that is out of balance, you want to be able to recognize, because otherwise you're going to waste your time and effort in counseling. And a lot of the counselors that I work with, because I refer my patients to counseling if they're not already in it, come back and they'll say, wow, therapy's going much faster so than it typically would with someone with these symptoms. And basically it's because we're helping the body get better. So you're sort of bringing the body into a calm state. Now the person can actually take in the therapy, the talk therapy or whatever kind of counseling that's happening. So let's talk about why you don't get results. So, you're watching this, I'm assuming, because you have someone that you love or you have symptoms. And so what isn't working? Well, I skipped that somehow. Well, hold on. I'm going to have to skip through this. Went back instead of forward. All right. So, symptom prescription relief cycle. One of the things, particularly with, let's take anxiety, oftentimes what happens is that, the drug solves the immediate problem, but it doesn't deal with the underlying issue. And because the person has that relief, they don't really deal with it. And so, so oftentimes, you sort of have enough relief that you're just like, I'm going to keep going but you're not really at your best. And the analogy I use with patients is just because you put a gallon of gas in your car and the light goes off doesn't mean you have a full tank. And so remember that symptom relief doesn't mean that you're healthier necessarily. So oftentimes we joke that we're the doctors of last resort. People try natural medicine last, and usually it's because they're so frustrated with whatever other types of treatment they've been getting. That's when they come to us. That's not totally true. I mean, we live in Portland, so there's lots of alternative people here, but it's not uncommon that someone will come in and they'll have seen 4 or 5 specialists, and each one has a different diagnosis, and they're really frustrated. So what are some of the problems with mainstream medicine and what people would call traditional medicine? Well, the biggest issue is people wait a long time and they feel rushed by the doctor. In fact, I had a patient come in not that long ago who told me that there was a sign on the wall in the exam room that said you were allowed to talk to the doctor about one problem only. And in fact, they tried to bring up the second problem, and the doctor basically cut them off. They said, you're going to have to make another appointment. I mean, this is not to critique the doctor, by the way. They're just overworked. I mean, they just don't have enough time to be figuring out what's happening. And, basically, that's a problem, because if you don't spend the time you can't really look and understand how things are interconnected and how the problem, how the symptom may be arising somewhere other than where it's showing up. And until you get the time to do that and sort of figure it out to unwind that, you're not going to figure it out. The body's way too complex. So the other thing is that the symptom prescription relief gets really expensive, and the cost benefit isn't always there. So it's just a problem for patients because they're spending a lot of money depending on their healthcare plan, and not really getting a lot of results for that money. So the other issue, and I've alluded to this a few times, is traditional medicine doesn't really address whole health. It deals with some of the physicality, but not really in terms of bringing the body back into balance. And that's a lot of what we do with people, is understanding how it's our bodies. I don't like to call a body machine because I think it's a lot more complex than that. But if you think of a finely tuned machine, when you bring it up to a really amazing level of performance, you can finely tune that. And when something goes off, you bring that back into balance. That easier said than done, but certainly, if you're looking holistically, you have a better chance of doing that. The other thing is that mainstream doctors don't look at nutrition, which, it's like going to a mechanic who says to put, corn oil in your gasoline, gasoline tank. I mean, it doesn't really lend itself. Your body runs on fuel, and it really needs appropriate nutrition, appropriate ingredients. Well, as Jamie Oliver says, if you're eating real food, there are no ingredients. The food are the ingredients. I mean, so it's important to recognize that. They also don't look at environmental factors very often, and we're going to talk a little bit about that. A lot of health issues can arise from environmental toxins and your body's inability to clear those toxins. The very few doctors, in my experience, will talk about the emotional component of illness, and they certainly don't talk about the spiritual component of illness and sort of how that fits into play. So, all right, so in the next video, we're going to talk about why a holistic approach delivers better results for your health. So let's see you on the other side of this.